osteoarthritis?
Osteoarthritis is the most common type of arthritis, especially among older people. Sometimes it is called degenerative joint disease or osteoarthrosis. Unlike other forms of arthritis, osteoarthritis affects joints only. Even though osteoarthritis is common in females, it is also seen in males, also in good numbers. 50% of adults over 65 years have some form of osteoarthritis, but only half of them will experience the symptoms. It is said that in India it is about 8-9% of population is having osteoarthritis. Osteoarthritis affects almost all joints of the body, but mainly affects knee joint, followed by hip and shoulder.
The human body is supported by a skeleton of bones. The junction of two bones is a joint. In a joint, the ends of the bones are covered by a slippery tissue called the cartilage. The cartilage allows the bone ends to slide over each other. It also acts as a shock absorber and protects the bone ends. There is a small amount of synovial fluid present in the joint. It serves to nourish the cartilage and makes it slippery. The joint is covered by a thick membrane called capsule and by strong bands running on either side called ligaments. The ligaments, capsule and muscles around the joint prevent the bones from moving too much and hence keep the joint stable. After understanding the normal structure, let us now have a look at what exactly happens if you have osteoarthritis.
The failure of the joint can be due to abnormal loading of a normal cartilage or normal loading of an abnormally weak cartilage.
In osteoarthritis, the cartilage degenerates. The cartilage becomes rough and develops cracks. This causes the bones under the cartilage to rub together, causing pain, stiffness, and swelling. The bone underneath the cartilage becomes thick and grows on the edges, forming spurs. Pieces of bone and cartilage may break off and float in the joint space, causing more damage and pain. The ligaments slowly thicken and contract. The muscles around the joint may weaken and become thin. This causes the joint to lose shape and the skeleton develops a deformity. What are your chances of developing osteoarthritis?
It is difficult to find out a single reason for osteoarthritis. Age-related osteoarthritis is common. Hereditary, obesity, job-related injuries, infections are some of the causes leading to osteoarthritis.
If you are above 45, if you are a postmenopausal female, being obese puts added load on the joints and damages it.
If a patient is having a joint pain, stiffness, swelling around the joint, difficulty in climbing and step down from the stairs, you may have to suspect that the patient may be suffering from osteoarthritis.
The most common symptom is pain in the joint, typically increasing after walking, standing for a long time, and is relieved by rest. Later on, however, the pain may become continuous. Pain while standing up from sitting or squatting position. Stiffness of the affected joint develops after a period of inactivity or early in the morning, more commonly in winter season. Swelling and numbness in the joint. A crunchy sound in the joint caused by the bone rubbing against the bone called crepitus may be present. If the doctor, after taking your history and clinically examining you, suspects that you have osteoarthritis, then you will be asked to take an X-ray of all the affected joints. The osteoarthritic changes in a joint can be seen in an X-ray. The space between the bone ends is seen to be reduced due to the thinning of the cartilage. Under the damaged cartilage, the bone thickens and on the edges form spurs. The normal alignment of the bones is disturbed. In certain cases, the doctor may suggest a procedure called as arthroscopy. Arthroscopy is the examination of the internal structures of the joint by inserting into the joint a specially designed instrument called the arthroscope. It is usually done to see the damage inside the joint. If actual repairs performed, the procedure is called arthroplasty. Arthroscopy is usually done to examine the shoulder and the knee. However, the elbow, hip, wrist and ankle may also be examined. Treatment.
We cannot reverse or cure an underlying disease process of the osteoarthritis. Aim of our treatment is to decrease the symptoms of the condition and slowing the progression of the disease. The principle of the treatments are maintain the movements and muscle strength, protect the joints from overload, relieve pain, modify daily activities, and education and psychological support. Environmental measures includes increasing the chair height, elevating the toilet seat, minimizing the use of stairs, using walking aids. Another measures includes weight reduction, and also you can use knee brace and knee caps. Another measure is physiotherapy. Patients with osteoarthritis have reduced muscle strength and restricted mobility. Exercise is therefore important in the management of osteoarthritis.
It is important to understand that osteoarthritis cannot be cured completely. So, the aims of treatment are: reduce the pain, maintain mobility, prevent or minimize disability, oral medications as decided by your doctor will be prescribed to decrease the pain and joint swelling. Certain analgesic creams applied locally on the joint may help to reduce the pain. Rarely, an injection may be given directly inside the joint. Short-wave diathermy also helps to reduce pain and improve the mobility of the joints. Exercise regularly to improve the mobility and also to strengthen the muscles. Avoid prolonged sitting, standing and squatting. Change to Western style toilets if required. Apply hot or cold packs to the joint for temporary pain relief. Braces and other support devices may help prevent further joint damage. Steps should be taken to decrease weight if necessary to prevent extra pressure on weight-bearing joints. In some cases, if there is no improvement, surgical therapy, which is replacement of the joint, may be helpful in improving the quality of life. Knee replacement.
Replacement surgery is done when all modalities of treatment has failed. Replacement of a natural joint with an artificial joint is called arthroplasty. Arthroplasty is done to correct the arthritis, that is the damaged joint that are painful or difficult to move. Surgery will not cure the disease. It should allow you to move easier and feel better. A person will appreciate a joint replacement who is having so much pain that affects the quality of life, their work, recreational activities, or a personal life.
Knee replacement is the procedure where creation of an artificial joint is done to restore the function of a joint. An incision is made on the front of the knee to allow access to the joint. Once the joint has been entered, pieces of the deceased bone are removed from the ends of the thigh bone and shin bone. The undersurface of kneecap is also removed. The knee prosthesis is then fitted on the prepared surfaces. It is attached in a manner that the original alignment of the joint is restored, removing any deformity if osteoarthritis has made your knees knocked or bowed. Now that you have seen and understood all about osteoarthritis, here are a few tips which will help you in prevention of further problems. A daily walk helps in strengthening the muscles and building denser bones. Stretching exercises should be done to keep body flexible. Special exercise for increasing the strength of the muscles in front of the thigh helps reduce pain in the knee joint. Maintaining a good posture, standing and sitting straight, helps protect the joints. Take adequate protection and wear safety equipments during sports or any major jobs to prevent joint injury. Maintain ideal body weight. Consult your doctor immediately for any persistent joint pain. A proper and well-balanced diet, including vitamins, minerals, and calcium, should be taken regularly. Following these points will definitely go a long way in helping you lead a normal and active life.